Hey everybody, and welcome back to my channel. I want to thank you all for being so patient with me while I gathered all of my material, got this video put together so that I could post it up for you guys. So today's content is going to talk a little bit about the initial testing that I had to go through in order to have my cancer diagnosis confirmed. So if you're here today just kind of curious, wanting to know what I went through, you're going to learn a lot about the testing, the machines that I experienced, and just different events that took place along the lines of me learning and finding out that I had cancer. If you're here, maybe you have a family member, friend, or if you're going through it yourself, I just hope that this video and this information can give you some clarity, some insight on what it's like, what's going on in the hospital, what these tests are like, what these machines look like. You know, I've been to school before and I'd heard some of these words. So when they were telling me you're gonna have some blood work done, you're gonna have a biopsy done, you're gonna have an ultrasound, you're gonna have an MRI, CT, they all sounded familiar, but again, at 33 years old, I've never experienced these things before, so it was all still very brand new. So I was happy that I was able to collect some materials, some photos, some videos, and gather it all, put it together for you today, and share it with you. So I hope you enjoy. Thanks. So you'll see me here getting my blood work done. They're checking my white blood cells and red blood cells, which could indicate an infection in the blood.
You're good. Nice. So this is gonna...
Okay, so after I had my blood work done, I went in for my mammogram. This machine initially is standing upright. You place your breast in between the two plates and it does squeeze it a little bit. It's getting photographs of the tissue and the tumor.
I know.
This is how the machine turns on its side. Again, it's to assist the doctors in getting photographs of all angles of the breast and the tumor. This is the type of photograph that the doctors are looking to get, and this is in fact my left breast and where my cancer was found.
Hey everyone, I'm here at Coleman Family Outpatient at UCSD, and I'm getting ready to go in and have my ultrasound done on my left breast. That's where they found my cancer. And I'm also getting ready to have a couple biopsies done. They want to verify that the tumor they see is cancerous, and also verify the size and be able to clarify what stage I'm in. As of right now, I think they said it was about 3.5 centimeters, if I'm not mistaken, and I'm currently in stage 2. So let the journey begin, or I guess continue. Thanks.
So the next procedure I had done was an ultrasound on my left breast, which was where the tumor was located, and also on my lymph nodes, which is found in my underarm. And this is to help give the doctors more imaging to signify whether the tumor is in fact cancerous and if it's begun to spread or not. So after all of the imaging is collected, I went in for a biopsy on my left breast because that is where the tumor was located. So they wanted to double check to see if that tumor was in fact cancer, and they also did a biopsy on my underarm in the lymph nodes because if the tumor did come back as cancerous, they also wanted to check to see if it's begun to spread. It wasn't too terrible, not too painful. There's some slight bruising after a few days, and after the bandages came off, there were just a couple little tiny holes that quickly healed over time. I'd have to say, out of all the tests and procedures that I had, this was probably the most uncomfortable. This was the MRI. As you can see in this machine, there are 2 little holes there. If you're facing breast cancer, this machine again takes more photos of the tissue and tumor that's going on inside your breast. So they have to go into those little holes. They lay you down on your belly, and as you can see, they gave me some headphones, and luckily I was able to choose the kind of music I wanted to listen to. This procedure does take about 35 to 45 minutes, and it does feel pretty lengthy when you're in there, but again, this is all for the benefit of, you know, your treatment and helping you get better.
All right, guys. So I just finished up. My appointment was at 2:45. Check-in was around 2:30. And I checked my clock. When I finished up, it was about 4 p.m. Took about half hour, 45 minutes, I guess. Quite the experience. I'll have to tell you about it here in just a minute.
Because of the length of time you're in the MRI machine, you may find that you're left with a red mark on your belly. It goes away after a couple hours, nothing too terrible. Next, you're going to see me getting prepped and ready for a CT scan.
Okay, 1, 2, 3. Okay, I'm putting in a little plastic straw. The needle I took out. So nothing sharp in there now.
Okay. So am I able to move my arm around?
You could,
Okay.
but you'll just feel that little plastic straw in there. It doesn't feel good, but it won't poke through. All this blood in the tube just tells me we're in the vein like we're supposed to be. This is just salt water, just to make sure it works again. Saline, yeah. You might get a weird taste in the back of your mouth.
Nice.
It's just salt water, I promise. And that's it. So when they give you the contrast, again, the contrast will give you a weird hot feeling like you're peeing down your leg. This never happened before. It won't be because of us if it does happen, but
I think I have had CT scan
Yeah.
because I feel like this sounds really.
yeah. So the weird hot feeling goes away on its own. Okay. And then today and tomorrow, drink a lot of water.
I've been drinking. So.
Okay. And it's just a personal question.
Not my face so much because I didn't do my makeup today. But okay, this is a very scary and kind of crappy situation. So I'm trying to do what I can to make it fun, I guess. And help others figure out what's going on with their facing.
So this is the last and final test that I had to have done, which was the CT scan. The machine looks really similar to the MRI machine, but it is different. You actually lay on your back. You're only in this machine maybe 5 minutes, maybe 10 at the most, just enough time for them to get your IV set up, get the contrast put in so that they can take the imaging, get you in that machine, snap a few photos, and then bam, you're done. So it was not anything like the MRI as far as the length of time, but the machine does look a little intimidating, but not too terrible at all. So there you have it. Thanks again for stopping by today and watching today's video. I hope that it helps some of you guys gain a little bit more insight on what it is like to go through the testing to have a cancer diagnosis confirmed. Before we wrap up, I just wanted to share a few words. Comes from Romans 8:28, and we know that in all things God works for the good of those who love him and who have been called according to his purpose. So God bless you. Just keep in mind you are loved, you are worthy, and everything that seems frightening and very confusing, there's a reason and a purpose for it. And trust and believe that everything is going to work out for the best. Thanks. Have a great day.